Hello, my name is Darwin and welcome to my Learn Hub. This post is our last post for clinical assessment lab PTA 214. This is week 9, and for the last post I will be discussing two special tests focusing on anything that's connected to our vertebra, to the spinal column, in the thoracic region, lumbar region, and the pelvic area. So the first test that I'm going to be discussing is the lateral and anterior and posterior rib compression. To help me with this test is Elizabeth, who is already in supine. So this test, by the way, is an assessment for fracture in the ribs, and the position is in supine. And the technique will be very easy. We're gonna do compression on both sides. It's a bilateral compression. So we're gonna be compressing on this side and the anterior and posterior portion of the rib cage. So I'm gonna start here on the left and right side, and I'm gonna compress. And then Lizzie, do you feel anything, any pain?
No.
Not that you have a fracture, but just in case. So we compress, move down to another region and compress again, and go higher, compress. So now we move to the anterior and posterior. So I go on top and at the bottom, and then compress. Is it too hard? Feel any pain?
No.
No. So she's testing negative, but for people who have a positive test, meaning they feel upon compression and they feel some kind of pain, that means they're positive for the lateral and anterior posterior rib compression test because they have a fracture. The second test that I will be performing on Lizzie is a very interesting test for the sacroiliac joint. A little background on the sacroiliac joint. It is an important region of the body because it acts as a facilitates the transfer of the weight from the upper body to the lower body. So it goes through that joint. It's right here at the back, where the two wing part of the pelvis joints. That is the sacroiliac joint. And the first test I'm going to be, because it's two parts. The first part is for the posterior compression test, which is the anterior. It's called anterior gapping. So in the supine position, so we're gonna find ASIS first. The ASIS is the anterior superior iliac spine. So it's the most prominent portion of the pelvic bone here in the front area. So I could tell this is her ASIS. So this is where we're gonna be placing our hands, and then I'm gonna start compressing. So as I compress, that pushes the sacroiliac joint to that compresses the sacroiliac joint posteriorly. So I'm gonna do that. And Lizzie, do you feel anything?
No.
And then I'm gonna move down. Okay, again, your goal is to compress the sacroiliac joint. Feel anything, Lizzie?
No.
Okay, so as we are assessing for sacroiliac pathology, what are the sacroiliac joint pathology? They could be mechanical strain. When you apply vertical pressure, it adds strain and injury to the sacroiliac joint. And it also results in joint disruption and degeneration and sacroiliitis. So the second part of the SI posterior compression test will be done in a side lying position. So Lizzie, go ahead and side lying position. So again, the bony landmark that we're gonna have to locate is the ASIS, and I'm gonna be pressing down on it towards So this is the posterior gapping. So the purpose of pushing it forward is to produce a gap on the SI joint here from behind. So that's why I'm pushing it, so that in order to produce the gap on the sacroiliac joint. It's kind of like the opposite of what we did earlier, because we were on top of her and we were producing anterior gapping. This time we're producing posterior gapping. So I'm pushing the ASIS anteriorly to produce that gapping from behind. Compression on the iliac crest. And pretty much the technique is the same thing, you know, apply lateral force to downward force to the ASIS. And for a positive test, they would feel some kind of pain on the buttocks area, the legs, higher spine, and pain below L5. Particularly with women who have pelvic tilt, anterior pelvic tilt, so there's a lot of pressure on their lower back. And that is the SI, posterior compression test.